let us start this session. We are going to look at reproductive health indicators. After that, then we look at surveillance in reproductive health. So those are the two sessions that we are going to cover during this time. So we have what you call health indicators. Health indicators allow us to gauge, to understand the health status of a given population. We can be able to know what conditions the community or a given population is suffering, what conditions are affecting most of the members of the community. So we can be able to state the most prevalent conditions and how many people are getting particular diseases and at what rate. So this is very important because it allows us to plan quite well and be able to respond to reproductive health problems that require urgent attention. So that means that a proper understanding of health indicators is very key. So before we look at what these reproductive health indicators are, we need to first understand the basics. And this is where you have the intersection between epidemiology and biostatistics. Okay, this is where you need to draw the connection between epidemiology and biostatistics. So the basics of counting, the basics of quantifying in epidemiology are to do with ratios, proportions, and rates. So we're going to look at what these really mean. When we talk about ratios, we are basically having one quantity divided by the other quantity. The quantities can be the same or they may not really be the same. So it can be that for every 10 patients, there is one doctor. That's the ratio. You can see that we are dividing patients and doctors. These are not the same. They are different quantities, but we can divide them. So the comparison between two quantities is what we refer to as a ratio. So it can be a quantity, whether it is you're dividing people by people, or you're dividing people by beds. Okay, the number of hospital beds versus the number of patients in the ward. So the things may not be similar and they may be different, or they can just be issues to do with a particular variable, and of course you should be able to know what a variable is. A variable is a given characteristic that an object may be having. Okay, it can be weight, it can be height, it can be anything that is a variable. It can be an opinion, it can be anything. But if you divide the two, you have what we call a ratio. So then we move to what we call proportion. A proportion is where you have a fraction or a percentage, where one part is part of the whole. One part is part of the whole. Okay, so for example, if you have a class of 10 students, and out of the 10 students, 4 are female. These 4 who are female are part of the 10. Okay, so 4 out of 10. That is a proportion because the 4 are part of the 10. That's the proportion. So you should know that. And then you come to what we call a rate. A rate is where you have the number of occurrence of a particular event, or the number of cases of a particular disease, and you relate that number with the time for a specified population. That's what we call a rate. So the rate has an element to do with time. Okay, so we have birth rate, we have the death rate and things like that. Okay, those are rates. So having understood the three, we can now go into what they really imply in terms of health indicators or reproductive health indicators. The rates provide us with a very good indicator in terms of comparison with other populations. Okay, so for example, if we want to know whether the rate of HIV in population A and B is the same or not, we can use what we call rates. If you want to understand whether the burden, whether the number of HIV and the number of people with HIV or getting HIV in population A and B, which one is higher, then we can use rates. Okay, so they allow for comparison. So if you say that for every 10 patients that visit the hospital, 3 have HIV. And then you have another population where you have for every 10 patients that visit the health facility, 1 has HIV. So you can be able to understand that the rate is higher in the other one compared to the later one. Okay, so rates are very, very important because they have that time extent to it, and that allows for comparison in populations. And it also gives us a good yardstick for measuring the effectiveness of our interventions. So if the incidence rate, for example, for STIs in a population that you're going to intervene is, let us say, 5, and then after the intervention it decreases to 1, then you can know that the intervention is effective. So the rates are actually very important. So the common examples of rates that we use are maternal mortality rate, infant mortality rate, contraceptive prevalence rates. Okay, this one you can see that the timing, the time frame for the first 2 are in a year. So the number of maternal deaths per 100,000 live births in a year, that is maternal mortality rate. Infant mortality rate, number of deaths for children under the age of 1 per 1,000 live births in a year. You can see that year is the time bit to it. Okay, and then contraceptive prevalence rate, the percentage of women of reproductive age currently using contraception. The time is the reproductive age, that is the time frame. So you can see that the rates have time frames in them. Okay, so having understood those, having understood the ratios, the proportions, and then the rates, now we can go into the reproductive health indicators. Like we say, that reproductive health indicators can help us in knowing which problem is occurring. So we can be able to detect whether the problem is on an increase or is on a decrease. So we can be able to know the trends. So the following can be able to tell us the trends of reproductive health issues. So 1, maternal health indicators. Of course, these are quite many. Okay, there are quite many, including maternal mortality rate, maternal morbidity rate, and then antenatal care coverage, and then uh, the prevalence of skilled birth attendants. So it's also an example of maternal health indicators. And then we have family planning indicators, including contraceptive prevalence rate, unmet need for family planning, the uh, demand certified for family planning, and then infant, and then sexual and reproductive health, and the rest. Okay, so we have many reproductive health indicators. One of the reasons that's why you really need to understand these reproductive health indicators is for monitoring and evaluation. So when you're going to have, if you're going to have a reproductive health intervention, let us say you're going to have an intervention focusing on increasing access to family planning methods, you'll have specific indicators for that intervention. Okay, so you need to be able to choose the right indicator at the baseline, and then later on during summative evaluation. Okay, so you choose the appropriate type depending on the intervention that you have at hand. The following slides are going to focus on the definitions of the different reproductive health indicators, what these indicators actually mean. We have already looked at contraceptive prevalence rate, which is basically the number of women who are within the reproductive age who are currently using any form of contraception. Okay, and then the total fertility rate, the number of children a woman is expected to have during her reproductive years. Usually, of course, the reproductive age is 15 to 49, based on the current fertility rates. So a South Sudanese woman can have on average how many children? The data that we have indicates that it is 6. Okay? And then what we call the antenatal care coverage. The percentage of pregnant women who receive at least one antenatal care visit during their pregnancy, with the focus on early initiation and the recommended number of visits. So that's the third reproductive health indicator. The other one is what we call skilled birth attendant. Okay, the percentage of births attended by a skilled healthcare provider, whether it is a midwife, a nurse, or a doctor, or a clinical officer. And then another indicator is called maternal mortality ratio. Okay, the number of maternal deaths per 100,000 live births in a given year. Okay, this actually reflects the risk of dying because of maternal causes. That is maternal mortality ratio. And then we come to neonatal mortality rate, which is the number of newborns, the number of deaths of newborns within the first 28 weeks of life per 1,000 live births. Okay, so this is a very good indicator of the health of the population. You see, if you have many neonates dying, it's a reflection of the poor state of health within a given population. Okay, so that's why we are saying it indicates general health status of a given population. and also survival of the newborns. And then contraceptive method mix, which is basically the distribution of different contraceptive methods used within a population. Okay, this provides insights on family planning options and preferences. If you have very few family planning options, then it means that there are women that are having what we call the unmet need for family planning, because there are those methods that are contraindicated for specific women. So the more you have a variety of contraceptive methods, the better. Okay? And then you have what you call adolescent birth rates. Okay, the number of births per 1,000 adolescent girls aged 15 to 19. Okay? When you have a high number, this illustrates that you see people are getting pregnant at a young age. So these are most likely unintended pregnancies. And that poses a very great problem. And then HIV pregnancy amongst the pregnant women. Okay? So the number of pregnant women living with HIV. Okay? This is an indication to the extent which you are likely to have a mother-to-child HIV infection. Okay, whether during pregnancy, childbirth, and others. Okay, that also the prevalence of HIV in pregnant women can be used to reflect the prevalence of HIV in the general population. Then indicators to do with feeding, especially exclusive breastfeeding, which has very protective mechanisms to the child. So the higher the prevalence, the better. And therefore you are most likely going to have well-nourished children and therefore good health. The unmet need for family planning, the female or the percentage of women who wish to delay or avoid pregnancy but are not using contraception. Okay, they want to use family planning but they cannot because of access reasons or issues to do with availability of reproductive family planning services. And then the prevalence of STIs is also another indicator. And then lastly, GBV prevalence of physical, sexual, and psychological violence against women and girls. Okay, it tells us the extent to which we have issues to do with reproductive health consequences, severe reproductive health consequences. If you have a high prevalence of sexual gender-based violence, it's likely that you're going to have numerous reproductive health consequences which are negative. Another thing that I think is worth talking about are the SDGs. The SDGs are the global agenda that were adopted by UN member states in 2015. They basically followed the Millennium Development Goals. So the SDGs have targets, and these targets basically emphasize that the member countries of the UN should make sure that they attain those targets by 2030. Okay, it's very important that the countries prioritize reproductive health in their programming to make sure that they can achieve the reproductive health targets that are associated with maternal health. For example, one of the targets is to reduce the number of maternal deaths to 70 per 100,000 live births. At the moment, South Sudan is having about 1,150 maternal deaths per 100,000 live births. But the global target is to reduce it to 70. So from 1,150 to 70, it requires a lot of efforts. And that is basically the SDG. Okay, so that marks the end of the first presentation. If you have any questions,